The am I on? The Occupational Therapy and Professional Licensing Subcommittee of Regulated Industries will come to order. We got two bills today, and I'm going to let Mr. Cox go first. We have another meeting immediately after this one, so I'm going to encourage y'all, tell us what you need to tell us, and we'll give you time to do that, but please try not to tell us the same thing twice. Mr. Cox, you want to tell us about your bill?
Yes, sir. Thank you. House Bill 391, which is LC 550443. This is the same bill that was brought last session. It got stalled in the Senate. In a nutshell, if you flip to page 2, lines 23, 24, 25, 26, and 28, we're basically removing these 5 organizations and requires them to get amateur sanctioning license from the Georgia Athletic and Entertainment Commission. The reason why is this allows for health and safety regulations, such as these organizations will have blood and eye exams, certified refs, judges, trainers, cutmen, those are the people that treat people in between rounds, ambulance and EMT on site, and also we'll have ringside physicians. The ones that are left on the list includes those that are part of the Olympic Committee or other associations like Georgia High School or NCAA, which currently have their own safety standards and or non-combative sports. So we're simply trying to move, let me back up. So the 5 that are being removed, 4 of those have had no response to wanting to be removed off this list, and one of them, which was line 25, that organization hasn't been in existence since 1972. So that is the bill, and I ask for your favorable consideration.
Members of the committee, you have questions. I see number 25. Who is that? Representative McDonald.
Representative Cox, this is the exact same bill we passed out of the House and went to the Senate with no changes. And how did it pass out of the House? What was the?
It was, I think we had 2 no votes.
Okay.
But I don't think they fully understood.
This was 2 years ago?
It was last year.
Last year, okay.
But it got stopped, and the Senate did not actually hear it in committee.
Okay, Mr. Chairman, at the proper time, I'd like to make a motion.
I recognize you at the proper time. And number 22, Representative Ridley.
Oh, I just had a quick question. So this is all about amateur, right?
Yep, yes, sir.
So why do, just out of curiosity, why is the Professional Karate Commission still in? On line 27?
I don't have an answer to that question, except for that it's listed as amateur is what I was told.
Okay. All right. I'll second his motion whenever proper time.
Okay, you let's see, you were number 25. Now is the proper time.
Right. Mr. Chairman, I make a motion that House Bill 391 be approved.
I have a motion in a second. All those in favor say aye. Aye. Those opposed, no. And your bill, Representative Cox, is in the full committee.
Thank you.
Thank you. We're going to wait a very short period of time for Chairman LaHood. Chairman LaHood, we're glad you could join us. You want to take a seat, and if you want to, take a second or two to catch your breath, and then tell us about your bill and remind us about the LC number that appears to be a substitute.
Thank you. Sorry for my tardiness. I had a page from back home, and we were last in line to get a picture with the speaker. I've got House Bill 314. This is a sub, LC 46109-1S. And what this bill is for athletic trainers to clear up some ambiguity, and the meat of the bill is on page 1, and it changes the word, it strikes the word injury and replaces it with condition. And I just walked or ran very fast over here, and if I had twisted my ankle or my knee, coming over here, the treatment for that, compared to if I twisted it on a football field, playing football, would essentially be the same. And my doctor could prescribe the treatment that an athletic trainer could do, just as if it happened on an athletic field. And that's basically what this bill is doing. It gives the doctor, prescribing physician, the option, which I believe they already have, and I have a expert here that I'd love to invite up here with me, if you'd allow, Mr. Chairman.
That'd be fine. Now's the time.
Mr. Higgs. And he could further explain. This is fine. And he could further explain, but that's essentially what the bill does. It doesn't expand the scope. That's not what athletic trainers are trying to do. They're just wanting to clarify that whether the incident occurred on an athletic field or elsewhere, that if the treatment is something they've been trained to do, then the doctor can write the order for them to treat them.
Mr. Higgs, if you would introduce yourself to the committee and tell us your background.
My name is Paul Higgs. I'm a licensed athletic trainer. I represent the Georgia Athletic Trainers Association, and we support this bill because it's based on wording recommended and requested by the Georgia Board of Athletic Trainers. I believe you have a letter from them endorsing this language, so it's based on their language. We think it protects the citizens of Georgia from unlicensed lay people making healthcare decisions that they're not trained to do and acting as athletic trainers. It clarifies the role of licensed athletic trainers so that patients know they have a choice in who provides their care. And it clarifies that injury is not always a traumatic accident, that you weren't hurt, something happened, now you are. That some conditions are gradual, they build, but they're all related to physical activity. We're not saying we should treat all conditions. If you read that first sentence, it qualifies the conditions we treat. It would be those related to physical activity, those that are require physical strength, agility, flexibility, range of motion, speed, and that's pretty broad, but it still limits our scope of practice to treating conditions that are a result of physical activity. So as Mr. LaHood said, crossing the street, hurrying from one meeting to another, you turn your ankle, he doesn't have to wear a jersey and carry a ball to be considered somebody we can treat. We're not limited to a setting, and that's in current practice now. We have athletic trainers that work in military bases across the state, in industries, in physician practices. They work in emergency rooms. They work in a lot of different settings that might see patients who have experienced a condition related to physical activity. So it just clarifies that to our patients and those we work with, to make it an easier decision and an easier understanding of who we are and what we do.
Thank you, sir. Members of the committee, questions? Mr. Ridley.
Thank you. I'm glad to see that you, on line 1 or line 12, that you changed from injury to condition, because clearly after seeing Chairman LaHood come over, he has a respiratory condition, not a respiratory injury.
Yes, exactly, exactly.
Okay, number 25, is that Mr. McDonald?
Yes.
Yes.
Chairman LaHood, I was looking at lines, I guess 61 through 63. It looks like also you've kind of strengthened this bill by the changes you've made of anybody that has, you know, the requirements of a curriculum that the college universities kind of created that, but the graduate has to be from an accredited educational program. So it seems like you strengthened this bill there too, different than the previous.
Yeah, thank you for recognizing that, and that's exactly what we're trying to do. Strengthen, like Mr. Higgs said, we want to protect citizens, consumers, from being treated by unqualified people or providers. And so, you know, the threshold for training is not going down. It's staying the same and being clarified even more. And so, yes, thank you for pointing that out.
Who's number 6?
I'll give you 2 guesses, Mr. Chairman.
That looks like Representative Williams. You recognize for a question.
Thank you, Mr. Chairman. You were mentioning, sir, and I want some clarification. I want to make sure I understand exactly what you're saying. And of course, when we say trainers, we think about sports activities. Does a trainer go in the blue tent and make the determination that there's been a concussion, which is big in football now? Who makes that determination on the field? Does the trainer?
We can be delegated that authority by the physician. We work under a physician's care. We would have a physician's protocol, but in the absence of the physician, they can delegate that to a licensed athletic trainer to make that decision. So yes, we would be involved in that. And legislation passed earlier has said that we're one of the few groups that can clear somebody to return to play as long as we're working under that physician oversight. So yes, we would be involved in those injuries and other conditions as well.
Okay, one further follow-up, Mr. Chairman. My question is, and I have not followed this, I've heard more about it today than I have since it's been around, but explain to me, Mr. Chairman, I think you would be in better position to explain this, Chairman LaHood. Where is the conflict, or what is the association when it comes to physical therapists who does not like this bill? So I need to know where in this bill do you cross over into their territory?
So it's my understanding, and Mr. Higgs can clarify, that today a physician can write an order for any patient, you know, to see an athletic trainer to be treated for, you know, whatever condition or injury that they may have that the athletic trainer can help with. Additionally, a physical therapist could do the same thing in most cases. And so there is some overlap. But when it comes to access to care, you know, sometimes we may have athletes who are actively involved in their sport, but their condition that needs to be treated happen off the field. So that's another example. But and it's also my understanding that we're seeing lots of instances where a physical therapy clinic who primarily does physical therapy is employing athletic trainers to work and do some of the treatment, you know, inside the clinic. Is that not true?
Sure. If I could add to that, there is some overlap between our professions, just like there's overlap between physical therapy, occupational therapy. There's overlap between athletic training and physical therapy. We see a lot of the same types of patients. This would do nothing to take away or add to what we do, or take away or add to what any other profession does. And sometimes we do overlap, and I guess we're like siblings that we're so much alike. Sometimes we get on each other's nerves, but we can work together to benefit the patient. There's some conditions we would not feel qualified to treat, and it's up to the professional to say, you know, doctor, I don't feel like this is appropriate for my training. I think somebody else should see this. So there's Parkinson's and things that have been thrown out that they would not be relevant to our training, and we would not treat those things. And those are things that are not related to physical activity either, if that helps you. So there is some overlap, and I think maybe there's some opinions that we may not be qualified to treat all conditions, and we're not saying that. There are conditions related to, as a result of physical activity, we think we would be allowed to train and or treat well. And that gives the patients a choice to who they can see, and it might get them in the system a little faster.
Thank you, sir. I think we pretty well got the answer to those questions. Do you agree, Representative Williams?
I understood quite well what he was saying.
We're going to move on to Representative Bennett. I'm going to recognize you to ask a question, and I would remind all the members of the committee that later in this procedure, there will come a time for discussion. This is, we're asking questions right now.
Thank you, Mr. Chairman. Thank you, Chair LaHood. Could you explain for me the difference between an injury and a condition?
So we had a few minutes to talk during session today, and you know, I'm not the expert on the difference, but I would say that an injury is something that may have happened suddenly. In a lot of cases, not necessarily suddenly. It could have happened over time. Where a condition could, you know, be someone with a comorbidity that complicates the condition or adds more complexity. And I think where you're going is, you know, we want to be sure that athletic trainers, or we want to be sure that whoever is treating the patient is qualified to do so. And that's why the physician would make the decision whether or not the athletic trainer is qualified, you know, to treat the specific patient. So we're not opening the floodgates. You know, the gatekeeper would be the physician, just like they are today. And the physician can send a patient to an athletic trainer today. This is essentially just clarifying that the as long as the condition is related to, you know, physical strength, agility, flexibility, range of motion, speed, or stamina, without respect to where or how the injury occurred, or condition occurred, excuse me. But the physician can make that choice today, and so that's not changing.
Could I follow up, Mr. Chair?
Yes, please.
If the condition is without regard, but it is there let's see, let me go back. I apologize. If you are saying that the condition for an athletic trainer to treat is not regard to how the injury or insult or condition occurred, is that what you're saying? Is without regard to an occurrence?
Yeah, I'm going to let Mr. Higgs chime in on that.
Yeah, that's currently in the statute, that we could treat things regardless of where or how it occurred, that condition. Too often injury comes across as a traumatic accident, a one-time thing that happened, and we're trained in our curriculum programs to see more than those things. Think of a skin condition, a rash. You don't quite know when it started. It wasn't a one-time thing. Some cardiac conditions or respiratory conditions, we're trained to manage those. More than first aid. We're not the physician, and we may not be the only provider for the entire length of that condition, but we would see more than just a traumatic accident, you know, a car wreck, a football injury, those things. There are several other conditions is a better definition of what we're trained to do in our education programs. And the patient and the physician and our own license holders makes that clear to the public. We see more than just the traumatic accident or injury.
Thank you, sir, for that.
Last question, Mr. Chair.
One more.
Thank you, sir. So would you tend to agree that a person with left hemiplegia or paraplegic or a child with spina bifida or any of those sorts would have a condition that will require an activity of physical strength, agility, flexibility, range of motion?
I would say no, that condition was not a result of physical activity. Now, we have athletic trainers that work in the Paralympics. They don't treat the condition that put that person in a wheelchair, but in a race, if their shoulder starts to bother them, their wrist, those things, that would be a result of the physical activity. So we might treat some of those patients, but not for the conditions that you mentioned. Not every condition would be appropriate for us. So some of those conditions are not caused by or a result of physical activity. So we would not think that's appropriate.
Thank you, sir. We're going to move on to Representative Earhart. Are you number 25? 24.
Thank you, Mr. Chairman. Real quick, and just to clarify, and just make sure I understood you, that one of the objectives of the bill is to ensure that unqualified folks are not engaging in the practices that are authorized currently in code for athletic trainers, what they're authorized to do.
Yes.
Correct. And then just to clarify again, because this part's not underlined, so I know it's currently in code. So they're part of the responsibility, or one of the responsibilities with athletic trainers is the treatment of athletic injuries, and then they list the ways that they're treated: heat, light, cold, sound, electricity, mechanical devices, all of that. I'm kind of reading off of just the definition of athletic trainer, lines 19 to 24. So I'm just curious. Can you give me some examples of folks who are not qualified to do this that are presently doing it? And the reason I ask, and correct me if I'm misreading this, I'm thinking of situations where there would be folks that are treating an injury with heat or cold that are not. I can think of some circumstances under which people in the public would be perhaps treating an injury, and it's not an athletic trainer.
Okay. Thank you for the question. Good. There are certain settings, and you can see those who work in a secondary school setting are not always required to have a license to make these healthcare decisions. Right. And we feel like anyone making a healthcare decision should be licensed to do so in whatever field that is. And we're allowed to do these things as other professions are. But people who are making those types of decisions should have a license from the state to do so.
Okay, if I may follow up,
Okay.
I just want to clarify, because I think maybe I'm not following this correctly. So let's say on a sports field, a middle school sports field, and there's an injury. Please correct me if I'm wrong. Are you saying that folks, if there is not a licensed athletic trainer present, that child can't be? Okay, so please clarify.
Okay.
Where am I going
Yes,
wrong here?
This would do nothing to take away from the Good Samaritan or anyone who want to provide first aid. It has nothing to do with that, and we encourage that. We want the people to do that. But any decision beyond first aid is an advanced level of training, and we feel like if you're using some of these other treatment forms beyond the basic things, that should require training, competency, a certification, a licensure, so things. So most of what you're mentioning could be first aid, and we would welcome that, and nothing would discourage or limit the Good Samaritan.
Thank you for clarifying that. I appreciate it.
Thank you, sir. Representative McDonald.
Thanks, sir. Mr. Chairman, don't you think this piece of legislation has to do a lot with logistics too? I mean, to be able to have these trainers on site, if you were having to take your athletes or anybody to licensed physicians, the transportation side, everything else, the time that it takes to do that, a lot of these conditions that you're treating might be just kind of symptomatic that you're treating. They're going to go out and still participate in the sports that day. And a lot of these physicians in these communities, Mr. Chairman, don't you think they know they're licensed trainers in their schools? They participate. They may even help educate some of their trainers with updates, or even give them equipment for their local schools as support for their training programs.
You're exactly right. And this is just a matter of giving people access to the care they need as quickly as possible so they can get back in the game or get back into life, whatever the situation is.
Just a quick follow-up, too, and that this goes to a man from Liberty County when he was talking about concussions. I mean, these trainers are trained in concussion protocol. I mean, a lot of these contact sports, they do baselines. They learn each kid what their baseline is. I mean, I take my son, for example, who plays rugby with the Citadel. He got hit so hard this past season, he got up and started walking towards the other sideline. Of course, came to the sidelines, they do concussion protocol. He feels like he can go back in, but his cheese done slid off his cracker. I mean, they kept him on the sideline. So, there is that baseline of concussion protocol that they know.
Yes.
Thank you. Let's move on and go to Representative Jackson. Let's see what he's got for us.
Thank you, Mr. Chairman. My question is simple. Can you give us an example how you would treat a condition versus treating an injury?
In some ways, there'd be no difference. It depends on the condition itself. If it was a result of physical activity, it would be within our scope of practice, is overseen by that physician. In some ways, injury and condition would be interchangeable. In some ways, they wouldn't. It's kind of, I hate to say it depends, but it depends on that condition. If it is something related to physical activity, a result of physical activity, we're probably the appropriate person to see that. I can't say every single time. I can't think of one it wouldn't be, but there may be one somewhere. Did you have one in mind specifically?
Yeah, because
Okay.
Representative Williams used CTE as an example, right? And having two sons currently playing football, how would a person evaluate a CTE condition versus a CTE injury?
In that case, I would.
If you are, based on what you just responded, that you're differentiating between an injury and a condition.
In that situation, I would say there probably is no difference. That injury would be the condition we could treat. And that would be a traumatic injury that people would say, oh, that's an injury. But we also say they're gradual things over time. Person comes in after practice and says, I don't feel right. What's going on here? And you have a neurological condition that we should treat and manage. And we may, through evaluation, say, you have a concussion. So,
Thank you, sir. Let's move
May I
on.
do a follow-up? One follow-up, Mr. Chair?
One quickly.
Okay. So if, based on your response, and I appreciate your subject matter perspective, so are you also saying then not all conditions require treatment, but every injury requires a treatment?
I don't think I'd go that far. I mean, I think some conditions would be minor. They require minor treatment. Some conditions would be more extensive and require more thorough treatment. I'm not quite following you.
All right. So if not all conditions will require a treatment, but we do know all injuries will require a treatment.
If I understand you right, I think it would depend on the severity of the injury.
Yes.
You know, from minor to severe.
Sprained ankle is an injury, will require treatment.
Again, I think there's different levels of severity, and trying to understand your the point.
So I
that
guess,
you're getting to.
so if we can't differentiate between injury and condition, wouldn't it just be helpful, because words matter up in this body? Wouldn't it just be easier than say on line number 12 that any injury and or condition sustained? Why line out injury based on what based on your response? You're saying you can't differentiate, or not every condition is going to require treatment, but we know every injury is going to require one. Why not just have both words and say on line number 12, athletic injury means any injury and or condition sustained, blah, blah, blah.
We're going to get an answer to this question, then we're going to move on.
I think that could be appropriate from what you're saying. And like you said, because injury sometimes is defined as just a traumatic one-time event, and there are things we treat that are not exactly that definition. Condition fits, but I think either or sometimes they are interchangeable.
Yeah, and I don't know that we're opposed to that suggestion. I think the rationale behind striking injury and putting condition is behind the idea that condition kind of covers all of it. But if you throw injury and or condition back in there, then I think it removes doubt.
Great. Thank you very much, Representative Smith.
Thank you, Mr. Chairman. Will you please shed some light on what's required to become an athletic trainer?
Currently, to be a licensed athletic trainer now, you have to have graduated from an accredited program, accredited by the Board of Certification, or it's another body that accredits the program. But once you finish that accredited program, you sit for the boards. You have a letter from the Board of Certification. They set our credentialing exam. So it does require a college degree. Right now, it is a master's degree only. You sit for those tests, and if you pass that certification test, the state will reciprocate with a state license that has to be renewed, and you have to maintain continuing education credits along the way to renew that license and maintain it.
So you do have to have a graduate degree?
Yes, right now, the only option for accredited programs are master's degrees.
Let me suggest that we do have some public comment, and I bet in that public comment we might shed some light on that question, Representative Smith. We're going to move to public comment. I'm going to ask you to try to do it within 2 minutes. I want you to tell us everything you feel like the committee needs to know, but our time is running short. We'll start with Kathleen. Is it Geist? Please come to the microphone.
Good afternoon. Thank you, Mr. Chairman and esteemed members of the committee. My name is Kathleen Geist. I'm the immediate past president of the American Physical Therapy Association of Georgia. I'm a doctor of physical therapy and have been licensed in the state of Georgia for over 26 years. APTA Georgia is appreciative of the efforts of the Georgia Athletic Trainers Association for bringing this bill to the attention of APTA Georgia. All members of the committee may be aware this bill has come before various House committees 4 times and has failed to move forward. The bill language remains unchanged from the past years, so I will take a moment to reiterate our concerns with the proposed language. These concerns for public safety and well-being are shared by my chiropractic and occupational therapy colleagues. Our area of concern and objection comes in Section 1 of the bill. Our legislative committee believes the change of wording would drastically change what athletic trainers can do under their current practice and educational model. In prior discussions between the APTA and the National Athletic Training Association at the national level, both professions agree that the scope of practice is based on the current professional educational degree from an accredited program, and no profession should provide services outside their education and training. As an association, we have concerns that the wording of the bill is vague, and we have asked to have clarification as to the implications of what conditions are needed to be treated. Treating an individual with range of motion restrictions that also has end-stage heart failure or lower extremity deficits as a result of extreme spinal cord injury will require additional knowledge of pathophysiology that are not seen in the current KD standards under the athletic training curriculum and what is provided in their formal education. The Legislative Committee of APTA Georgia believes that this legislation is intended to be a scope change. Our interpretation of the language is that athletic trainers would be able to treat anyone with any condition under a physician's supervision, meaning they could potentially treat an individual with range of motion limitations as a result of Parkinson's or treat a child with neurodevelopmental delay. To our knowledge, these types of conditions are not part of the scope of an ATC or is what is offered in their programs. Doctor of physical therapy programs provide differential diagnosis within their educational programs as required by our accrediting body. Physical therapists are trained to perform differential diagnosis on every patient and client upon their initial examination and throughout the duration of their care to ensure an individual does not have a more serious condition that requires referral to another healthcare provider.
Are you close to wrapping?
Yes, and we are not limited to providing any type of services under the supervision of any other healthcare provider.
Thank you. Members of the committee, you have questions? Let's see, I see Representative Ridley. Wait a minute, I'm going to get you turned on.
So you said that you think that the athletic trainer should have a list of injuries or conditions that they can treat?
I do. I think conditions has to be very specified. I mean, injury, I think about injury to ligament, tendon, bone, that is a kind of a some type of tissue in the musculoskeletal system, versus condition can be any type of disease, symptom, cluster of symptoms from any organ system.
Okay.
Spinal cord injury, developmental delay.
Under a physical therapist, do y'all have a list of things that y'all can treat?
We have not necessarily a list, but we incorporate all the systems of the body to include neurological, cardiovascular, cardiopulmonary.
So what draws the line of when it needs to go to a neurologist or something like that?
Anything related to anything of impairments, physical activity, or participation limitations is a direct result of insult to a neurological structure, stroke, spinal cord injury, Parkinson's, any movement deficit that's related to a neurological condition.
Is that based, is
Let's
there
make this
a
final.
list
We don't
under the
have an
law?
extensive list, but we do have it very well defined in our scope of practice.
Okay.
Within our
Thank
list.
you very much. We're going to Representative Smith. Are you?
Will you please tell me what percentage of your patients are not referred by a primary care physician?
Currently, we are allowed to practice without a physician's referral. And again, that can be from anywhere, it depends on the clinic where you are. It can be anywhere from 100% to 50%. It depends on the area in which you live. But we are not required to have a physician's referral to practice. Within the state of Georgia, we have an exception. We have a provisional scope of practice.
Thank you. We're gonna move on. We about to beat this horse to death. Thank you for your testimony. We've got Tom, is it Bauer?
Yes, sir, Mr. Chairman.
He's an occupational therapist, I believe, who represents him.
I represent them, yes. I did stay at a Holiday Inn Express last night.
That's good.
Let me start off by saying I have the utmost respect for Chairman LaHood, and we've worked together on a lot of issues. I think we've agreed to disagree on this for a while. I'm not going to repeat what the PT representative said. I do want to point out a couple of points. As this bill's come up over 4 years, we kept hearing that they needed to clarify or change their scope of practice so that they could discipline folks, and this goes to the layperson thing that Chairman Earhart was asking about. And we kept asking them for examples, and they kept saying, well, these are all confidential matters with the professional board. Well, it's a simple matter of giving examples with things redacted. So I just don't know the problem that's broken that we're trying to fix. But I would agree completely that when you take injury and turn it to condition, and condition in the medical literature says that it's much broader than injury, and you say that you can treat a condition no matter how it occurs, basically, then she's right. If you have a heart attack on the field, is that going to allow an AT to do that? And so I think it's, I don't know what we're fixing here that's broken. The states all around us have athletic trainers working on athletic injuries. Their scope specifically mentions that, and it just seems to me we're talking about a profession that wants to expand from what they started at, which is athletic training, and get into conditions that that could be anything, because it's not tied to recreation or organized athletics.
Great. Thank you for your testimony. I'm gonna recognize Mr. Aubrey Valines.
Thank you, Mr. Chairman.
Tell us who you represent.
Aubrey Valines with the Georgia Chiropractic Association, our general counsel. We respectfully disagree that this is not an expansion of scope. It's a huge expansion. If you look at line 13 of the original bill, you're striking exercise, sports, games, and recreational activities. This is now limited to athletics and sports. Now they can treat car accidents. If someone has these injuries arising out of a car accident, they can be there. A slip and fall, Representative LaHood just said it himself. He's walking down the steps, that acquires mobility, dexterity, and whatever, and he falls. They can now treat that with this bill passes. Domestic violence, repetitive stress things, turning a screwdriver over and over, has nothing to do with sports, carpal tunnel syndrome. But now, once you strike those words of limitation, exercise, sports, games, those are words of limitation. You have now opened it up where they can treat in car accidents, slip and fall, domestic violence, repetitive stress. When I went back home to White County over the weekend, I had to cut up some oak trees. I stood in the creek and got them up and cut them, and then I got them in the pickup truck and got them back and split what I could. And in doing that, I've got a brace on my knee because it aggravated a condition, not an injury. And that condition is arthritis. It aggravated that. I also got a cold from standing in that cold water. That's a condition. They couldn't treat any one of those, even though they do involve physical strength, agility, flexibility, and range of motion. They couldn't treat any of those unless this bill passes. If this bill passes, they could treat the asthma I might get from doing that activity, the splinters that flew in my eye from the chainsaw and gave me an eye infection, which didn't happen, fortunately, but I did get a rash on this arm. All those things could be treated now that, if this passes, it could not be treated before. Not to mention the fact of things like car accidents, slip and falls. This is a huge expansion, a huge expansion. We asked you to oppose it. We're willing to work with the author to come up with different language, but this is a huge expansion, and I'll be happy to answer any questions you may have.
Thank you for your testimony. We're going to move on and see if we might have a motion. I'm going to recognize Representative Ridley.
Yes, sir. I do want to make a motion. But before I do, I just want to tell you how highly impressed I am that you were down in the creek this weekend cutting wood in 30-mile-an-hour winds and 4.5 inches of rain. You must be able to walk on water while you was doing that, because it was rough up there this weekend. I'd like to make a motion to do pass at the proper time.
Now's the proper time.
I make a motion.
Is there a second? I have a motion and a second. Discussion among members of the committee. I hear none. I assume you're ready to vote. We're going to do a show of hands. All those in favor will raise one of the other hands. 1, 2, 3, 4. Those opposed? 1, 2, 3. The motion passes and the bill is in the full committee. Thank y'all for being here, and I appreciate your patience.